Hey, it's Friday. It's TGIF Doc Talk with Dr. Go.
Hi everyone, and welcome to another episode of Doc Talk. And today we'll be speaking about a very interesting scenario in elderly with dementia, particularly Alzheimer's disease. And this symptom is called sundowning. Now, sundowning it comes from the name sundown, where the sun starts to go down, and it's commonly used to describe a scenario of elderly with dementia where they start to become very confused, very disruptive when it's later in the day. Could be late evening all the way to midnight or even early hours in the morning. And typically, when you see sundowning, there's a very high chance that this elderly person has Alzheimer's disease. And what we usually see is that there is a significant increase in confusion or agitation during this period. The elderly will usually be more restless. They will start pacing around. They will start looking for food. They will start folding their clothes. They will start, going to the shower, bathing with their clothes on. They will have difficulty in sleeping. They will start yelling, or sometimes they may even have some degree of hallucinations. Now, to put into a bit of perspective, family members often misunderstand the intentions of the elderly, and sometimes elderly with dementia, they may be misunderstood by their family members that they are just trying to be intentionally be difficult. And one of the main purpose of this podcast is to highlight that this is actually not the case. Sundowning is actually one of the major symptoms of Alzheimer's disease, and it's consistent with many individuals with Alzheimer's disease, and it's usually due to a pathological something which is going on in their brain which causes them to be like this. They're not intentionally trying to be difficult, and usually this is caused primarily by the disruption of their internal body clock, their circadian rhythm. So when it comes to the evening, they become very active. It could be due to the reasons of too much rest during the daytime, or they may be overly stimulated in the evening. They could have some unmet needs, like they might be in pain, they might be in hunger, they might need to frequently use the toilet. This one is something that we usually see in elderly men with prostate issues. They also might have some underlying medical issues. They could have dehydration, it could be medical side effect, or sometimes it may just be, they might be in a new environment. Say they just moved into a nursing home. It's a new environment, they're very anxious, and they start to, just constantly feeling anxious and not able to actually sleep. Now, when sundowning happens, there are some practical strategies that we implement to reduce the symptoms. Now, usually the first step that we will advise is to actually establish a routine. Now, we try and minimize too much or too excessive sleeping during the daytime, so that we try to keep them active, so that when it comes to the evening, they will be able to, feel very tired and they will go to sleep. One of the other ways is to actually have a very calm and non-disruptive nighttime rhythm. So avoid things like bright lights, loud noises. Just try to have a very calm environment during the nighttime. You can play soothing music or calming sounds, and also just to ensure that before they go to sleep, just to make sure that they're not hungry, they're not in too cold, they're not in any pain, and this usually will help to make them feel a bit sleepier during the night time, so they can actually sleep for longer hours throughout the night and reduce these sundowning symptoms. Now, of course, this is very much easier said than done. In reality, majority of the senior citizens with sundowning is not so easy to handle, and very often things may become much more severe. They may start to have a risk of falls, so safety concerns. They start to wander around, they start to go out of the house, they might start climbing stairs, they might start playing with the stove on and off the fire, and it may actually cause a lot of major safety concerns. Or if such symptoms are becoming really frequent and very severe, they might be shouting and causing disruption to the neighborhood or even to the family members. And this actually may result in a situation where caregiving becomes really, really stressful or overwhelming for the family. And this is actually the circumstances where you should seek help. And typically, you can either see a geriatrician or a psychiatrist, and usually they will give certain medications to manage these sundowning symptoms. Now, the medications, it could be medications which helps with moderate to severe stages of Alzheimer's, and sometimes these medications actually help to solve these symptoms of sundowning. In certain more severe cases, the psychiatrist or the geriatrician, they might start certain medications to sedate the individual, especially during the nighttime. However, such approach is usually the approach of last resort, because using sedatives is something like a double-edged sword. The drawback of that is that it significantly increases the risk of falls for the elderly, because when an elderly person is on sedatives, for whatever reason, if they actually manage to wake up during the middle of the night, the risk of fall is extremely high. So nonetheless, this is usually the drug of last resort for solving sundowning, and most often geriatricians or psychiatrists will not use this unless absolutely necessary. So I hope all listeners would be able to understand what is sundowning, and if you have any other suggestions or any topics that you would want to know more about elderly or dementia, feel free to just post us a message and we'd be happy to share. Thank you.
Click the share button to share this episode to a friend or a caregiver and hit follow to keep up with our latest episodes. Thank you.